Hi, my name is Dr. Brady Rhodes. I'm a board-certified foot and ankle surgeon here at Baylor, Scott & White, All Saints in Fort Worth. Here today to discuss with you about some basic tips for planning and preparing for the Cowtown Marathon, including a few things to consider in regards specifically to the foot and ankle. As a 4-time full-distance Ironman finisher, 5-time half Ironman finisher, and a finisher of the Cowtown Marathon and half marathon myself, I felt I had some unique perspective to offer from both an athlete standpoint and also from a medical provider standpoint. The Cowtown Marathon itself is as unique and classic as Fort Worth. It offers multiple different races, including a 5K, a 10K, a half marathon, and the marathon. Which race you should choose is dependent on a number of factors. Number one, your overall medical health. See your primary care doctor to see if running a race from 5K to marathon is safe or healthy for you. Also, take in mind your running history and also your history of any musculoskeletal injuries, including tendon problems, joint problems, or stress fractures. Keep in mind it might be a good idea to consider seeing a sports medicine doctor or a foot and ankle specialist who has knowledge of running mechanics and training in general before signing up for a race. Once you have decided which distance race you would like to compete in, it's important to find a training plan that works and is appropriate for you. There are many resources online and multiple free training programs for distances from 5K all the way up to the marathon. Another important fact to take in mind is your overall volume itself. If you have no specific running history, I recommend you start with 3 1-mile runs during the week and 1 3-mile run in the weekend to see where your overall base fitness is. But what's most important is once you begin your new training plan is to not increase your mileage by more than 10% per week. Following this rule will decrease the likelihood of you developing tendon injuries, overuse injuries, or stress fractures, particularly in the foot and in the ankle. As a foot and ankle specialist, I'm frequently asked, which shoe is best for running? Like running shoes, all foot structures are very different. They range anywhere from a flat arch to a normal arch to a high arch. As a general rule, I would recommend what is called a neutral style running shoe. This type of shoe will accommodate multiple foot structures. Any local running store will have dozens of options that you can choose from to help specifically prevent you from sustaining injuries in your foot and ankle. Another question I frequently receive is, should I get an orthotic or a custom insert for my shoe? As a general rule, I advise against getting a custom orthotic if you do not have any specific pain or abnormalities in your foot at this time. A flat foot isn't always necessarily a bad thing. Pronation isn't always necessarily a bad thing. The joints in your rear foot use pronation as a way to absorb shock during running. So with some patients, an orthotic can prevent pronation and thus reduce the amount of shock absorption you have in your foot and can actually predispose you to injuries. Now, if you already are having foot problems that an orthotic is helping, of course, continue with an orthotic in your running style shoe. But as a general rule, I would not recommend an orthotic for every patient or every athlete. Another thing that's very key and crucial to preventing any injury in the foot and ankle is keeping a log of the number of miles you have on your shoes. Most shoes today will claim you can run up to 500 miles on one pair of shoes. I recommend you cycle through 2 or 3 pairs of running shoes and to not run in each pair of shoes for more than 300 miles. Overuse of shoes can lead to a breakdown in the foam, hardening the durometer, which is the specific softness of the sole of the shoe, which can then lead to tendon injuries and stress fractures in the foot and the ankle. Also, try to avoid fads with running shoes. Zero drop, maximalist shoe, minimalist shoe. Find a shoe that feels comfortable for you. Shoes are measured in what's called stack height, which is the thickness of the sole on the bottom of the shoe. For most runners, I recommend anywhere from a 30 to 38 millimeter stack height in a shoe. In addition to that, a shoe is graded in what's called the drop, which is the difference between the back of the shoe and the front of the shoe. For most runners, I would recommend anywhere from a 4 to 8 millimeter drop. This will decrease tension on your Achilles tendon and your plantar fascia and make it less likely for you to develop common musculoskeletal injuries that we see in the foot and the ankle. The most common injuries I see in the foot and ankle, particularly with runners, is stress fractures, Achilles tendonitis, and plantar fasciitis. One way we can prevent this is to be very consistent and aggressive with doing posterior muscle group stretches. The calf muscle, the soleus muscle, and the Achilles tendon are what we refer to as the posterior chain of the lower leg. If we did a biomechanical analysis of 100 patients off the street, upwards of 75 to 80% of those patients would classify as having a condition called equinus, or tight posterior muscle group. This leads to abnormal mechanics in the foot, which can then lead to, as previously mentioned, stress fractures, Achilles tendonitis, and plantar fasciitis. I congratulate you for finding a training plan. I congratulate you for running and making a goal to complete a race. However, don't overdo it. As a general rule, I recommend 80% of your runs, you should be able to carry on a conversation without having difficulty breathing. Whether that means you're running a 7-minute mile, a 10-minute mile, or even a 13-minute mile, 80% of the time you're running, you should be able to have a conversation with a friend. This will help to build an aerobic base, make your heart stronger for racing, and also make it less likely for you to have overuse and stress-related injuries. In addition to your training, nutrition is essential for preventing injury and for fueling your race. If you'd like more specific information, I recommend finding a local nutritionist to help guide you with your nutrition plan. What I recommend as a general rule is making sure you have an appropriate amount of protein for recovery. As a general rule, this equates to anywhere between 75% and 100% of your body's weight in pounds converted to grams of protein. For example, if you're 100 pounds, I recommend you take in 100 grams of protein a day. This will help with muscle health and recovery. In addition, it's very important to refuel the glycogen stores that you've used during exercise. Be sure you're taking in an appropriate amount of carbohydrates before exercise, during exercise, and even after exercise to help restore those glycogen stores which are kept in your liver and in your large skeletal muscles. Another piece of advice I have is don't ignore the pain. Listen to your body. Our bodies are smart. They will tell you when it's time to slow down. It's important to take 2 or 3 or even 4 days off to help prevent making a small minor injury turn into a large injury that can prevent you from training or even completing your race. If you have pain in your foot or ankle, for more than 2 weeks duration, I highly recommend you seek out a local board-certified foot and ankle specialist, particularly a specialist who has some emphasis and knowledge about running and foot mechanics. Race day nutrition and sticking with your plan. You've gone through your training plan, you've bought the right shoes, you've been doing your stretching, you've stayed healthy. Stick with your plan on race day. Don't overdo it. Don't go out too hard. Listen to your body and enjoy yourself. Remember why you're here. Remember the hard work you've done. And remember, less than 1% of the American population has completed a marathon. So even if you run slow, you're still going faster than 99% of America. Good luck, enjoy your race, and keep that foot and ankle healthy.